In recent years, there's been a growing body of research underscoring the detrimental effects of ultra-processed foods, UPFs, on human health. A new study published in the American Journal of Preventive Medicine has found that UPFs, which include packaged snacks, sugary drinks, processed meats, and sweetened cereals, may be linked to an alarming number of premature deaths annually, possibly even more than the number of deaths caused by fentanyl overdose. In 2018, the study estimates that nearly 124,000 premature deaths in the United States were directly attributable to the consumption of UPFs. This statistic is concerning when compared to the nearly 74,000 deaths from fentanyl overdose in 2022. Ultra-processed foods are a significant part of the modern diet. They make up more than 70% of the U.S. food supply, and their widespread availability and convenience have contributed to their consumption on a massive scale. These foods are often high in unhealthy fats, sugar, and salt, which have been directly linked to a range of serious health issues, such as heart disease, type 2 diabetes, cancer, and even mental health disorders. The researchers who conducted this study analyzed data from several countries and found that the risk of early death rises by almost 3% for every 10% increase in calories derived from UPFs. The findings are sobering and highlight a significant public health challenge. However, despite the compelling data, the study has not been without its criticisms. Critics have pointed out that the study does not conclusively prove that UPF consumption directly causes premature deaths. As nutrition scientist Nares Asbury noted, the research only suggests a correlation, and without further evidence, it is difficult to definitively claim that UPFs are the primary cause of these deaths. This lack of causality is an important nuance that should be taken into account when interpreting the findings. Additionally, the study did not account for other lifestyle factors, such as sedentary behavior, alcohol consumption, and smoking, that could contribute to the increased risk of death in individuals consuming high levels of UPFs. The complexity of human health means that multiple factors, not just diet, contribute to premature death. Furthermore, the study has sparked debate within the food industry. Sarah Gallo, Senior Vice President of Product Policy at the Consumer Brands Association, which represents the food industry, criticized the study, claiming that it was misleading and could lead to consumer confusion. She argued that the definition of ultra-processed foods remains unclear and that demonizing these foods could have unintended consequences. Gallo's concerns are not without merit. Ultra-processed foods are often affordable, convenient, and shelf-stable, making them an attractive option for many individuals, especially those in lower-income households. If these foods were to be excessively vilified, there is a risk that consumers might avoid nutrient-dense options altogether, leading to poorer overall diet quality. Moreover, removing convenient food options from the market could exacerbate existing health disparities, particularly for those who rely on affordable and accessible food sources. Despite these criticisms, it is clear that the consumption of UPFs is a significant factor contributing to poor health outcomes. The study's findings indicate that countries with higher consumption of UPFs, such as the United States and the United Kingdom, have a greater proportion of premature deaths linked to these foods, ranging from 4% in lower consumption countries like Colombia to nearly 14% in the US and UK. This highlights the importance of not only understanding the potential risks of UPFs, but also exploring ways to reduce their consumption through public health initiatives and dietary recommendations. One of the key challenges in addressing the impact of UPFs is the lack of a universally accepted definition of what constitutes an ultra-processed food. This ambiguity makes it difficult to create clear and consistent guidelines for consumers and policymakers. As the debate continues, it is essential to balance the need for accessible, affordable food with the recognition of the harmful health effects that can result from the overconsumption of processed foods. Ultimately, the study serves as a reminder of the importance of focusing on whole, minimally processed foods in our diets. While ultra-processed foods may offer convenience and affordability, they come with long-term health costs that can outweigh their immediate benefits. In light of these findings, it may be worth considering a shift in dietary habits, prioritizing more natural and less processed options to reduce the risk of chronic diseases and premature death. However, it is equally important to recognize the complexities of the issue and not oversimplify the impact of processed foods on health. Comprehensive public health strategies, along with continued research, are essential to address the growing concerns around UPFs and their role in public health outcomes.